We are very grateful that everyone has come to our facility this morning to share in this with us. I'm Jay Landers. I'm the Director of Development and Outreach. We have a number of our associates who are here. We have members of the Chamber of Commerce Ambassadors Group. The United Way of Central Illinois is represented here. We have so many partnerships and collaborations, and that's what nonprofit organizations are all about, partnerships. We're going to commemorate a 14,000 square foot wing that will soon be under construction. And I want to welcome remarks first from Mayor Michael Houston.
Well, good morning. Welcome, and let me begin by making a few thank yous to people that have made this project possible. One of the first people I'd like to recognize and thank is Alderman Doris Turner. And Doris has really provided leadership efforts in terms of not only with this project, but really in terms of working in her ward, which this is a part of her ward. But more importantly, she has really provided leadership throughout the entire community. She cares not only about the residents of her ward and all the people of Springfield, but she really is deeply involved in terms of health care for our residents, not only here in Springfield, but literally across the state, and does really a very, very good job. So, Doris, thank you for your efforts. You know, this project wouldn't be possible without Governor Quinn and the capital projects bond program that he put together. $3 million of the funding for this expansion is coming from that project. And certainly as we think about the people that are really involved in terms of the services, the board of directors, the medical and dental staffs of the Central County's health centers, I mean, these people on a daily basis are changing the lives of people for the better, and they do it for very, very little financial reward. You know, the impact that the staff of this facility has on the lives of the patients and families that they deal with, I mean, it literally is immeasurable. And in all the healthcare problems that we have in this country today, what they are doing is really, really having a major impact. And to each and every one of you that are involved with this organization, on behalf of the community of the city of Springfield, I really want to thank you for what you do. You know, this expansion represents another good reason to live in Springfield. We all know that it's much easier and much cheaper to prevent people from being sick than to cure them from sickness and illness when it has waited too long to be gone too long untreated. Access to affordable preemptive health care is a duty that society must assure to everyone. We as a community are uniquely fortunate to have the civic visionaries and public administrators who continue to advance and support our community's level of health care. The expansion will complement the stellar health care here at Central County's health centers with modern innovation, better care and comfort, more privacy, and state-of-the-art equipment and environments. We've needed this expansion for a long time, and now, as technology expands medical capabilities, we'll have more and better medical and dental services for low to moderate income individuals than ever before. Today is a great day to be breaking ground on such a jewel for the Springfield community. I'm really pleased to acknowledge all the persons who have stepped forward to make this project happen. It's a great day to celebrate as an expansion in really a great city, and it is an asset that we are adding to our community. Again, I thank you just for allowing me to participate in the project, and I really want to thank the people who work with this on a daily basis for what you do and the impact that you are having on the people of our community. Thank you very much.
Thank you, Mary Houston. Appreciate that very much. I'm holding today's State Journal Register. You don't know what this means to a nonprofit. We're on the front page. You couldn't buy this. It's priceless. We appreciate so much the support of the print and broadcast media surrounding this groundbreaking event. It's just great. A hand for the media, please. Alderwoman Ward 3 Doris Turner is with us, and she has some remarks.
Good morning. I am very, very, very excited to be here today, and I really want to commend Craig Glover and his staff for everything that they're doing here. I remember when this health center first opened up on 11th and Monroe and then moved here with the expansion, and just to see what Mr. Glover has done is just truly remarkable with the addition of the dental and just recognizing the needs that are in the community and then making it happen right here on this corner. So thank you, Craig, for everything that you're doing. As a public health professional, I am so excited because think about what it means to have an expansion of the services here for all those low-income, uninsured people who need health care but don't have any place to go to access it. Not only are they going to be able to come, but come in larger numbers and come at times when it's beneficial to them. With everything that people have going on in their lives, oftentimes healthcare is not one of those things that they think about until there's an absolute need. But one of the great things about this expansion is when they come here for that need, they will be able to get in touch with all those other auxiliary services that they need to think about, and it'll be a one-stop here. They'll be able to come here and get everything that they need at one place at one time. And for those of you who have insurance coverage and have the capability to just think about those things, you really don't know what it means to those individuals that really need it and need it at this particular time. And as a city alderman, I am very excited because not only will it mean the availability of more health care for the residents of Springfield, but it will also be an opportunity for us to grow our economic base. When Governor Quinn made the funding possible for this expansion, he was also making it possible for people to go to work. For people to go to work and be able to, take care of their families in a way that they may not otherwise be able to. So this expansion will mean that there will be construction jobs that will come to Springfield. There will be more people that will be able to work. But then it will also mean that those individuals that are in healthcare will have more opportunities from those physicians all the way down to technicians and medical assistants. So it just runs the gamut for what it's going to mean from an economic standpoint for the citizens of Springfield. So I'm excited. I think that we're really blessed with the great weather that we had to be able to go out and break this ground. And I am really I live just about a block. I'm about done. I live just about a block from here, so I pass by here all the time. So I'm going to be excited to see the progress as they break the ground and then start doing the construction and start building. So I'm looking forward to seeing it as it moves forward and coming back when it's finished to see all the possibilities become a real reality. So thank you very much for coming. Thank you very much, Craig, for everything that you're doing, and I'm excited about today.
We've acknowledged a lot of community organizations and the associates who are meeting with our patients and keep our facility operating. There is a very important group of individuals behind all of that, our board of directors. And in a nonprofit such as this federally qualified community health center, the board meetings occur monthly. Think about that commitment. A monthly board meeting. And over half of the members of the board are consumers of Central County's health centers. Bobby Hall is our board president.
Good morning, and thanks so much for coming. Again, my name is Bobby Hall, and I'm the board chair. And we have some other board members here. I'll call their name and ask them to raise their hands so you recognize them. Jim Knockway and Donald Waters. And I don't think I see any others, but I'll tell you the name of some of the others you might know because they are fully committed to this work. Julie Jansen, she's is a member. Dr. Sam Gaines, Geraldine Johnson, Racine Freeman, Ida Jackson, Mike Miles, Bobby Norman, and Evelyn Ivy. Our board is strongly committed to providing high-quality primary health and dental care, and we believe that such care is the right of everyone. Also, we are so proud of our relationships with local, state, and federal partners and our membership in the United Way of Central Illinois. Today, this groundbreaking ceremony matches our mission, goals, and objectives to expand access. We celebrate to remind our partners how much we value the patient who choose Central County as their medical home. So thank you very much.
In addition to this milestone event in the history of Central County's health centers, Craig Glover, our president and CEO, is celebrating his second anniversary this fall, so we welcome Craig. Thank you.
Good morning. CCHC, as we know it today, got its start when a group of volunteers from the local medical society began providing free medical services in the basement of First Presbyterian Church. It didn't take this group of volunteers very long to realize that the demand for services far exceeded capacity. In 1997, Healthy Springfield 2000 was formed. The mission of this nonprofit organization was to address the primary care needs of the uninsured and underinsured residents of Springfield. The name Healthy Springfield 2000 was chosen because the organization had the goal to increase access by the year 2000. In October 1999, Healthy Springfield 2000 was funded as a federally qualified health center. As an FQHC, the organization received federal dollars to provide medical care for the uninsured and underinsured residents of Springfield, primarily those on the east side of Springfield. In its first year of operation, the organization employed one doctor, one full-time nurse practitioner, and one part-time nurse practitioner, along with the complementary support staff. In the first year, they provided services to 3,087 patients. In 2002, the board of directors changed the name to Central County's Health Center. Also in 2002, by then the organization was providing services to over 5,000 patients. The demand continued to grow. In 2003, CCHC received a grant to provide services to the homeless population of Springfield. In the first year, provide services to 322 residents. Today, we provide services to over 1,300 homeless residents. In 2004, the organization moved to this facility. That move was quadruple the amount of space compared to its original location on 11th Street. Also in 2004, in conjunction with the move, the organization started providing primary dental services. Today, CCHC provides medical and dental services to more than 17,000 patients annually who generate more than 50,000 visits. The mission of providing services to the uninsured and underinsured has not been lost. In fact, in 2012, 60% of our patients were Medicaid recipients and another 30% were uninsured. To help our uninsured patients, we provide discounts, income-based discounts. 90% of our uninsured patients qualify for our largest discount, which means they pay $20 for a medical visit and $25 for a dental visit. We are pleased that you've joined us today to mark another important event in the history of CCHC, the expansion of our facility. With this expansion, we will add 14,000 additional square feet. That includes adding an additional 13 exam rooms. We will have space for an on-site pharmacy. Our pharmacy partner will be on site with us so that our patients are able to come here for all of their services. In addition, we will have space for on-site lab collection. Our goal is to have our patients come here and be one stop for all their primary care needs. Adding this space also gives us a possibility of expanding our services in the future. We envision possibly adding podiatry services, ophthalmology, perhaps radiology, so we can help with mammograms and other things. This expansion is important because we know that there is increasing demand for our services. We are fortunate that we are in a state that is providing expanded Medicaid coverage as well as the ACA options, but we know there are people out there that still need additional services. So adding this addition to our facility will allow us to meet the increasing demands for our services. So I'm grateful to all of you for joining us today as we celebrate this special occasion. And before I take my seat, I also like to acknowledge a couple other folks. One, I'd like to give great thanks to our board of directors and Bobby Hall as our chair. These group of folks, as it was mentioned earlier, once a month they're providing their time to come and make sure that our facility continues to provide the care that's needed in our organization. Another unique thing about us being a fairly qualified health center is that the majority of our board members are consumers of our services. So the patients that come here have a voice in the services that we provide. The other group of people that I want to acknowledge is the staff. This is a great staff to work with, and as it was mentioned earlier, next month I will celebrate my 2-year anniversary, and this is by far the best group of folks that I've had the opportunity to work with. We have dedicated doctors and nurses, clinical staff of doctors and dentists, our clinical staff, our nurses, support staff. Every day they do a great job providing an excellent patient experience, and without them this would not be possible. So I like to publicly thank them because quite honestly it doesn't matter a whole lot what I do. It's more about the work that they do in providing the services to our patients every day. So again, thank you for coming out to celebrate with us. Our project will begin with actual construction within the next couple of weeks, and it's estimated to be about a 13-month project. So around this time next year, we will invite you all back as we have a ribbon cutting. Thank you very much.
Okay, now the fun begins. We have 4 shovels at a cost of $6 per shovel with Rust-Oleum paint on the blade. We're a nonprofit. We've got a spot all picked out. And if you'll follow us outside, we'll pose for the ceremonial groundbreaking.
We can't get it up.
A little hard.
Oh, I got some.
There we go.
Hey!